we can take a person and remodel their gut microbiome with diet. On average, 116 fewer calories per day were absorbed just by changing the type of food, not the amount.
Dr. Karen Corbin, she is a PhD researcher, talker, keynote speaker. Why is fiber versus simple, trashy carbs so important to the gut microbiome?
Simple, trashy carbs are going to get absorbed in the small intestine. They're just not really going to travel all the way down to the colon.
Fiber is the preferred food for all the microorganisms in your colon.
Yes, especially the ones that promote healthy functions. When you starve them by eating mainly ultra-processed foods, then you starve the gut bacteria.
Is that leaky gut?
Yes.
How do we know if our microbiome is healthy enough? So listen, today on our podcast, we're going to talk all about something that I'm going to contend until a few years ago, probably not that many were thinking about, and that is the gut microbiome. And so today, as part of our partnership with Advent Health, who were the presenting sponsors for the Women's Health Conversation Summit, which is coming up again in November, so keep a lookout for that, is Dr. Karen Corbin. She is a PhD researcher, talker, that's not how you say it, speaker, keynote speaker, and caregiver who she just shared with me is in midlife herself. So we're going to have a marvelous conversation. And you know what, Karen, I think that we hear a lot about the microbiome, whether we know what it is or not, but I want to start way back. If you will start at the place where I commonly hear the microbiome described as more than 1 trillion stars in the sky are the bacteria that live in our gut. Just take us, why are they there? How in the world do they get inside our body, for God's sake? And then we'll go down the road about how critical they are in midlife.
Yeah, that's a wonderful question. And there really are trillions of microbial species, and they live all along the GI tract, which is, open to the outside, much like our skin also has microbes because it's open to the outside. And all the way down at the end of your GI tract is the colon, which most people never think about. It just seems like this boring place where whatever bits of food haven't done their magic in the small intestine land until they get exported out the other end. But in reality, in that environment, there's what I call a metabolism show. These bacteria, viruses, fungi, and yeast have genomes. They have genes like we do, and they're active, and they're actively metabolizing that food that we could not digest. And so it is that community that is so impactful for our health because it talks to us. It sends us hormones, it sends us metabolites. It helps us process nutrients and medications.
I ate breakfast twice this morning. I'm like a hobbit. I eat a first breakfast and a second breakfast. I know we can get into that later. But so it enters the top of our GI system, our mouth, which has its own microbiome. And then it starts to digest, goes down our esophagus and to our stomachs where acid hits it. Do any bacteria live in our stomachs?
They do, but only specific ones that are able to handle that environment. Just like the colon has no oxygen, so only bacteria that can live without oxygen can survive down there. Whereas in our mouth, the ones that actually can live in oxygen are the ones that survive.
Isn't that fascinating? It's like different floors in an apartment building. Okay, then we get into the stomach. It passes through to the small intestine where we're breaking down food until finally, miles later, we're at the top of the colon, which is where you started in the environment without oxygen, where you just told us that it's sending signals. So we get a clump of food, or actually not food. We get a clump of liquid, actually, out of the small intestine, dumps into the large intestine. What are the bacteria doing? The lactobacillus, the bacterio. Listen, I learned some words for this. Yeah. What are they doing?
They are fermenting undigested foods like fibers, like resistant starches, or any little bits of fat and protein that might have escaped that absorption in the small intestine.
So when you say fermentation, many people are going to start thinking about, wait a minute, isn't that what we do when we brew beer in our closets in college? Or isn't that what we're doing when we're making kimchi or sourdough? We're fermenting in our stomach or in our colon. And by the way, when you put it that way, no wonder it produces gas and different things, right? So we have a fermentation, we have a still in our colon.
Exactly.
Oh my God.
I like to call it, the science geek word I use is a bioreactor. So there's just biochemistry going on in there that, frankly, as a registered dietitian, I didn't know anything about it in the 90s. And now it's amazing how much it does to make something out of things that we couldn't do anything with, like fiber.
So just as part of the normal metabolism of this host of microorganisms that live in our colon, they're just doing what they do, right? They may or may not realize, if we make them sentient beings, that they are in our colon. They just think they're somewhere, but they're doing what they are doing, reacting to each other, digesting the food source that we're giving them, whether it's macronutrients like protein, carbs, fiber. Hopefully we're giving them fiber, or garbage. Oh, by the time it gets there, it's just a different kind of, So we're giving them, we're dropping this in on them. They're doing what they normally do. How are they talking to us? Because you said that earlier in this conversation. How are they actually talking to us?
So, the fermentation process is their metabolic process. And so they import whatever foods they can eat. And that's the thing. The microbes are picky. Some like protein, some like carbs. And so if you provide the microbes what they like to eat, they import it, and then they make something on the other end. Probably the most common thing that people hear about with the gut microbiome are called short chain fatty acids, which is the primary metabolic output of many microbes. And then those can get into our bloodstream. And once they're in our bloodstream, they can travel to different tissues and have their effects. But if I could also say, there are also direct connections with nerves, like the vagal nerve from the brain goes straight to the gut. And that is a direct communication highway. And guess what? The microbes can make neurotransmitters. So it's more communication than even just food. It goes all the way to direct brain talk.
I'm glad you brought that up, because I do want to get to later in the conversation these axes that we talk about, the gut brain, the gut bone. But so the vagus nerve, which is a hot nerve right now, everybody's talking about the vagus nerve and how to stimulate it or settle it down, goes directly to the gut. These microbes who are doing their jobs are making neurotransmitters, which are directly communicating to the brain. Fascinating. This is so fascinating. But you also said that they are breaking down what we're feeding them to short-chain fatty acids. I think, unless you've been made to study anatomy, people may not realize that there are parts of the gut that are about one cell layer thick, right? So we think it's this giant, ugly-looking tube, but on the very inside, it's filled with villi. And the barriers of these little fingers, they literally look like fingers that have a high surface area, can be one cell layer thick. So that's how the short chain fatty acids can get directly to the bloodstream, right?
Yes, there's actually receptors, which are just proteins that can grab or bind to things, and then they get imported in. And that mucus layer, by the way, sounds so gross, but it is so important because it is what keeps the things that shouldn't be in our body inside the colon. And so maintaining that barrier is very important, and diet is one of the ways that we can do that.
So before we get deeper into the jobs of the microbes and how they're affecting people, we've followed the path of food from our mouth, through our acidic stomach, through our small intestine, to our colon. And then honestly, frankly, when we're done with all the good stuff, that's when we excavate or excremate, or whatever word we should use. We poop it out. We poop it out, frankly. Thank God we get rid of everything we don't need. Why there's so many questions people are going to want to know. So they're doing their job. Why is it critical that we feed our gut microbiome complex carbs like fiber? Fiber is a hot topic. Besides the vagus nerve, 30 grams of fiber a day is a hot topic out in the stratosphere now. Why is fiber versus simple trashy carbs so important to the gut microbiome?
So the simple trashy carbs are going to get absorbed in the small intestine. So they're just not really going to travel all the way down to the colon. But the fiber does travel, and it is a preferred food for these microbes. And that substrate, if we want to just get nerdy, it's a substrate for a chemical reaction. So this fiber then allows the healthier flora to grow and survive.
Flora meaning bacteria. The flora is another word for people who've never heard that before. Not flowers, flora. So fiber is the preferred food for all the microorganisms in your colon.
Yes, especially the ones that promote healthy functions. Now, when you starve them by eating mainly ultra-processed foods that have the sugars that are not complex, then you starve the gut bacteria and they get hangry. They need food. It is our job to feed them. That, you didn't know that before, that you had to feed yourself, your dog, your kids, your partner. You also are responsible for these little engines of metabolism. And when they get hangry, they make inflammatory molecules. So we know inflammation is another hot topic in health. They eat up the mucus. They say, you're not going to feed me? Fine. I'm just going to eat that protective mucus layer and break it down, because they can actually get carbohydrate out of that. So it's really just such a simple concept that feeding your gut microbiome intentionally is important, not just for you, but for them. And in return, they do a lot of great things for our bodies.
When they eat, because we starve them, and they're forced to eat whatever they find, they're picking up trash up, and they're going to eat the mucus lining, which is not only functional but protective of this really thin cell layer. Is that leaky gut?
Yes, that is one of the ways that leaky gut can start. And leaky gut is very prominent in things like IBS. It's still not clear whether in something like diabetes or obesity, whether there's really enough of a leak. But regardless, you want a nice, healthy, thick covering of all those beautiful fingers that you talked about, so that we can keep the bad stuff out of the body and out and allow the good things to come through. 116 calories doesn't sound like a lot, but over a year, that's 42,000 calories that you put in your mouth, but your body never saw them. So that's exciting. But that also reprograms the output of the microbiome. We have beautiful data on things like short-chain fatty acids and other things. And it also increases the release of hormones that help you feel full. Yay, this is exciting.
You may think your bones are fine, silent, but if you're a woman over 40, your bones are talking to you, and unbreakable bone is how you answer back. During perimenopause and menopause, your bone loss can triple without us even knowing it. That is why I created my 8-shield Building Better Bone program, including Unbreakable Bone Nutrition Augment. Built on clinically studied collagen, microcrystalline hydroxyapatite, and the essential micronutrients your skeleton needs. It's the only formula designed by an orthopedic surgeon who spent 25 years rebuilding bone, muscle, and movement. Stronger bones are the foundation of a longer, more powerful life. Start building your unbreakable era today at shop.drvondawright.com. So now that we've established the pathway and the anatomy, and that we have to feed these guys, not starve these little guys, I'm giving them a personality so we care. Because if we can't identify with these trillions of microbes, we're not going to care. But if we personalize them, they're guys, they're gals, they're doing jobs, right?
Having a party down there.
They're having a party. That's why we're going to care about these little guys, because they're so important. How do they I don't want to really get into how we get there. They get there usually through vaginal birth and picking up in the microenvironment and from babies from their mothers, that kind of thing. But once they inhabit their environment, how do they change as we age? Right. And if we take it by, if you don't mind, let's talk about, because when I talk about the musculoskeletal system, for instance, I don't start by talking about 75-year-olds breaking their hips. I start with talking about peak bone density at 25-ish. So if we take 30, 40, 50, let's just walk through what we know about how this microenvironment changes.
There are many things that we do throughout our lives. We just talked about the main one. If you starve them all your life, then you're in trouble. Exercise also is very beneficial, also for your musculoskeletal system. So it's a double bonus win.
Why is
Antibiotic
exercise
use.
important? Why is exercise important for the microbiome?
Exercise also changes the human metabolism, and the human then can communicate back to the gut. So it is a two-way relationship. One of the main things that is believed to go from a heavily exercised person into the gut is lactate, which is something that, when your muscles get sore, you have a buildup of lactic acid. So that's one potential communication route, but those specific routes are still being uncovered. But there's definitely sufficient data showing that healthy, active people have a healthier gut flora.
So then we've established the gut flora when we're babies and children. It rolls along in our 20s and 30s if we're feeding it something substantive. But can we specifically talk about what changes as our hormonal status changes? Because we know during perimenopause, as we have fewer and fewer eggs, we're secreting less and less native estrogen. It affects every body system, including the microbiome, the gut. Can you talk about some of the specific things that women could experience during perimenopause? I mean, I get comments all the time like, oh, I'm bloating more. I don't digest as well. Things that worked before didn't. What is the role of hormones on the gut?
Well, part of that has to do with the pelvic floor, actually, because a healthy pelvic floor is important for the bladder and for the colon, something I didn't know until I started having problems and learned about that. So that's one thing. Estrogen also communicates with the gut microbiome itself, and the gut microbiome can actually take estrogen that we were meant to excrete and actually revitalize and open it back up. But it's not believed to be in a beneficial form. So there's, again, these communication highways that occur. Also, certain medications interact with the gut microbiome. So as we age, we may be taking medications. Of course, antibiotics would be the most obvious ones, but even other medications have been shown to either impact the microbiome, or the microbiome can impact their how well they work in the body.
Well, what's interesting that I observed in myself is I have never my whole life been a yogurt eater. I mean, I just couldn't stand the taste of it and the thought that it was a live culture, whatever, all the things. I fed it to my children. I mean, I fed it to my baby early, but I didn't start eating it. Now I'm religious about it until perimenopause and menopause, because I recognized that something about my digestion was changing, and I was recognizing how different foods affected me. And I thought, well, why don't I just supplement my microbiome with healthy lactobacillus and bacterio. I always miss the last part of that.
I think it's Bacteroidetes, but yes,
right. And you can
so
get
many.
that in the live culture of yogurt. And so it's made a world of difference. I mean, that's why I'm a 2 breakfast person. As I mentioned earlier, I eat yogurt with blueberries first, and then later in the morning before I leave, I pile on my regular breakfast. But I mean, it's really something I noticed. Nothing changed. I mean, I've always eaten healthy. I don't change the way I eat, but something about the way it was received changed. And women tell me that all the time.
Yeah, for sure. There's this, the food that you eat that's called a prebiotic. So it feeds the gut bacteria that you have. And that's critically important, because if you take a probiotic, but it ends up in a hostile environment where you starve it, then it's not going to stay there and do its thing. So having a combination of enough fiber and resistant starch and eating foods that might have some of these bacteria, even though we can't yet tell you, okay, Dr. Wright, you need these 25 species in your body and we're going to make you a custom probiotic. We're not quite there yet, but these kind of standard ones that come in food products definitely can help somebody if those are not there, especially if you feed them and allow them to hang out a little bit longer.
Well, I love that you brought up the prebiotic, which basically is another way for saying the food you feed your gut. And we want it to be complex, fibrous, what they want. Give them their favorite food, for God's sake. Versus probiotic, which is giving actual live cultures to supplement what you have.
And when you eat them together, that's called a synbiotic because they synergize. Just to throw more.
I wonder, though, how do probiotics in yogurt live through the stomach acid? How do they do that?
Yeah, I mean, I don't know how much of it actually gets all the way down there. If you don't have a protective coating, something that promotes it getting, but maybe there's something that happens earlier in the GI tract that could have some effect. But if something makes you feel better, you're getting calcium, which you need for your bones.
Well, you know what? I just thought of that question, and it then makes sense that maybe probiotics need to be taken in a capsule that only melts in the pH of the colon or low or small intestine.
Yes, and there are some that have a capsule that's actually a prebiotic. So you're actually getting both at the same time. The efficacy of those is questionable, but if you want to take one, that's definitely one way to make sure it gets down there. I think there's, fermented foods, yogurts. A lot of people feel good when they eat those. There may be benefits that we're just not quite understanding that may be independent of how many bacteria actually get there and do their thing. So my recommendation is always if you feel good eating something that has other benefits like protein and calcium, go for it.
Just do it. So the question is then, how do we know if our microbiome is healthy enough? How do we know if we need all this stuff? How do we know we need a probiotic other than the advertisements are telling us? How do we know if our gut is suffering and we're not having GI upset, diarrhea, all the bad things? But how do we know it's healthy?
There is no standardized diagnostic that can confidently tell you there's a specific problem and we know how to fix it. But what I do know is that our community of microbes does dwindle as we age. So eating those prebiotics to allow it to flourish is a good thing, whether or not you're having symptoms of GI upset. And then, the probiotics from food sources may have intangible benefits that we're not quite understanding how they work. But if you feel better, those could be helpful as well. But I personally wouldn't spend, $500 a month on some fancy probiotic because the science isn't quite there yet, in my opinion, to warrant that. When you look at microbiome science, one of the things that is missing is understanding the whole community and how they talk to each other and how they work. We might say, oh, this bacteria is up, this one's down. And that's nice, but that means something different for you than to me, because I might have a very hostile community. So that bacteria goes up and it's not going to be able to survive. Whereas you might have with your 2 breakfasts, a very healthy community. And when you make these changes, they stick, right? So, and that's some of the science we're working on right now, which is why I love talking about this, because once we get there, once we can say, we know what this guy eats and how it feeds this other guy and how they're working in community, then a therapeutic is more likely to be possible, because we're not sort of isolating it to units that on their own don't tell you the whole picture. just like genetics, right? There's a lot of things like diabetes, obesity that cannot be explained by a single gene. You have to understand how those genes talk to each other. It's the same way with the microbes.
So this question is not meant to get anybody in hot water, but as a scientist, I'm sure you have the degree of skepticism that is necessary to be a curious scientist. Where are we right now with all these microbiome tests? And I can name some like Viome and etc., where you send in a sample, they're quantifying what bacteria you have, and then either selling you something, making recommendations. Is that actionable right now? Do we trust what the data we're getting, or right now we're not quite there? What are your thoughts?
In my opinion, we're not quite there. And that's because just like even when you do the same thing with human genetics and you say, let me tell you, give me your genetic profile, I'll tell you what to eat. That doesn't understand the whole person. What do they eat? What do they breathe? What medicines are they on? What disease do they have? All the things. So you have to really consider the whole person. And again, I think, it's nice to know what you have and what you don't have. And I think it's interesting, but to say, because of this, you shouldn't eat mushrooms. Like, where was the randomized clinical trial to show me that that actually matters?
And do we know what is optimum? It begs the question, Karen, sorry I interrupted you, but it begs the question,
okay.
If we're optimizing towards a standard, which, do we even have a standard? Do we know how many units we need of lacto versus basidio? No, the answer is no.
The answer is no. And what's interesting is most of the science doesn't actually measure units. So it doesn't say you have 1,000 of these and 10 million of these. It just measures relative. And so, but there are ways to measure how many species of A, B, C, D you have. And we're working on that right now with some of our diet studies, because I think that's important too, right? Not just kind of relatively how do things move about, but, if all of a sudden you have a species that goes from 100 to 10 million because you made a positive change in your life, oh boy, that must be really important for the effect we're seeing. Let's figure out what it's doing, and then let's target it therapeutically.
Interesting. So the science is out, ladies. So proceed with caution. But that leads me to, I'm going to ask you to put on your registered dietitian hat now. What's a woman to do? What should we do? Is there a baseline standard that you believe in that we should try to hit to be as healthy as we can? What do we need to do?
Yes. So, and we know this from our own research, that we can take a person and remodel their gut microbiome with diet. And these are controlled diets that they eat in our research institute. So we know they ate all the food. And in that reprogramming, when you feed certain things, there's 4 things we did that, those are the 4 things I'm going to recommend. People absorb less calories from the foods that they ate, which is kind of helpful if you're trying to lose weight. So on average, 116 fewer calories per day were absorbed just by changing the type of food, not the amount. So that's kind of exciting, right? Because who likes to eat less? Name one person.
So go down this road. Everybody's totally perked up now. They're like, what did she just say? Okay, continue to tell us about your research.
Now, 116 calories doesn't sound like a lot, but over a year, that's 42,000 calories that you put in your mouth, but your body never saw them. So that's exciting. But that also reprograms the output of the microbiome. We have beautiful data on things like short-chain fatty acids and other things. And it also increases the release of hormones that help you feel full. Yay, this is exciting. So what were the 4 things? So we already talked about the main thing. The idea is every day, ask yourself one simple question. Have I fed my gut microbiome today? And if you haven't, these are the 4 ways you do it. We talked about 1, dietary fiber, soluble and insoluble. So veggies, fruits, whole grains should be a component of the diet. The second thing is resistant starch, which is like a cousin of fiber. It is a type of fiber actually, but it has a different configuration, and it's in things like beans. If you like beans, literally throw them on everything. And I know people say that make them gassy, but I promise if you introduce them slowly, you can get used to them, because we fed our study participants like bucket loads of beans and we did not have more adverse events on the microbiome friendly diet. So they were able to do it for 22 days, no problem. And so besides beans, there are certain starches, like kind of the weird ones that aren't the typical ones. Quinoa, farro, actually oats are one of them. And then degree of ripeness. So green bananas have more resistant starch than ripe bananas. But also certain starches, when you let them cool after cooking, they develop them. So oats become a double whammy if you cook them and stick them in your fridge and let them cool overnight and make those overnight oats, because now you get an increased dose.
Especially if they're steel cut, right? They're even more.
Even more, because that's the third component, is eating more whole foods. Whole foods have two benefits. One is they have bigger pieces. So that gives a chance of some of those pieces to make it all the way down to the colon where the microbes can get to them. But the second one is that whole foods are their original versions, as compared to ultra-processed foods that are unrecognizable versions of their original selves due to mechanical processing, so totally breaking them down, and chemical additives. And neither of those things make your microbiome happy. So those are the four things: fiber, resistant starch, whole foods that have bigger pieces, and avoiding processed foods.
Got it. And by doing that in any order, like there are books out that say you got to eat your fiber first, followed by your protein, followed by any order, or just get them in?
As far as I know, any order. I haven't seen the randomized trial that shows that order matters. I can't imagine why scientifically it would. But listen, if you're an organized person and you like order, put
might
some
as
order
well,
in
right?
it.
Get it done.
I'm good with it.
Yeah.
Not going to hurt you.
Get it done. Well, something I have noticed in my tracking all the data in myself, I'd show you my CGM, because although I'm not diabetic, I'm very interested in how different foods affect me. I see a profound difference in the type of carbs I eat. Highly fibrous, it just stays like this. Maybe it does this, but there's nothing wrong with a blip in your blood sugar as long as it comes right back down. What's wrong is the plateau and stay business. So profoundly different way my body receives fuel by the type of starch I eat, right? And I've done this long enough, I can totally know what's going to happen. And it does matter if I am going to eat something that's more simple than I would normally want to. If I surround it with protein, I also don't get a spike. Versus
Absolutely.
I just pop, something dangerous in my body like candy, which I don't, but would I? I do once in a while. Okay, people, just to be honest, once in a while, but I pay for it. Karen, I pay for it. My gut knows, my brain knows. It's crazy how your body is so fine-tuned.
Especially when you stop consuming it for so long and your body's just not seeing it, putting it in is like a shock to the system. That combining of carbohydrate, protein, and fat is really a very long-standing nutritional principle, because the fat and the protein slows down how the carbs are go down the GI tract and are absorbed, and that's what helps the blood sugar to rise more slowly, which gives the insulin enough time to bring it down. So that's a really good thing. And if you don't mind, I'd like to talk about protein a little bit, because everybody's very into protein right now, especially with the advent of very effective weight loss medications that are allowing people to reach weight loss of 20-25% of their body weight. A key to protein in the diet is to have fiber in the diet as well, because very high protein diets that have no fiber, what are they going to do to your microbes? Starve them.
Starve them. Interesting.
Starve them. And under those conditions, they will ferment protein and make toxic metabolites. So you want to have that balance. And we actually, with our diets, we were able to reduce those toxic protein fermentation metabolites in our study participants. And this has been replicated by other people. And one of the things that's really important for giving you a sense if you're sort of having a healthy, happy gut is how often you poop. Because when you get stuff out, you don't give the microbes all that extra time to keep fermenting. So you need a balance of allowing them to ferment, but not for too long and not the wrong stuff. So if your bathroom habits have changed, making these diet changes will help with that and will also reduce some of these not so nice microbial metabolites.
You know, it's so interesting because now I'm sitting here going back to practicality thinking, okay. With my Hobbit breakfast habit, why don't I in the morning, because I put blueberries with my yogurt to add all the goodness of that and some fiber. But in my refrigerator right now, there is a Tupperware container full of steel cut oats that we prepare once weekly. It's sitting there. They're steel cut, they're whole grain. They are resistant fiber because we're refrigerated the heck out of them, right? But if I just add that to my yogurt, I'm getting 15 grams of protein with the resistant starch. So my microbiome is going to be so dancing up and down, I think.
Yes, 100%. The other thing you can do is add ground flax seeds. That's going to give you protein, more fiber. Doesn't have to be a whole bunch. And even nuts. Nuts are great because you get protein, fat, fiber. Not to mention, all of that has a lot of vitamins and minerals. You know, we get so excited about the protein and the carbs, we forget how important those vitamins and minerals really are to our bodies.
Every time I talk about the microbiome, I get I'm feeling like, oh, that's so exciting. It's so interesting, especially that your own research that you shared with us today. Not only, okay, so the hook would be absorb 163 calories less, but the meat of it, if you will, is how the interaction works. And the four things that you cited for us, the simple dietary framework that we can use, because, you know, Karen, women are confused. I'm confused
I don't blame
sometimes.
them.
There's a lot of information that's plus minus, but what you presented today was things that every single person could implement, because you even went so far as to say, without changing the volume of food, we change the absorption of food, you know? So it's fascinating.
And I think another great thing is whenever we talk about going on a diet, it's like, oh, who wants to go on a diet? It's a restrictive mindset. Feeding the microbiome is an abundance mindset. You are thinking of the things you can do more of. And I'm not saying you only have to eat plants, because some people do great on vegetarian diets. Some people don't. You can implement these 4 strategies into any eating plan that you like, that aligns with your culture, your beliefs, food access, everything. There's so many things that impact our food choices, but in every single meal, you can do at least one of these things and still eat food that you like. Who wants to eat cardboard? Nobody.
Right. And nobody does. You know, the reality is this happens, right? People do well all day long, and they've been eating cardboard all day not in the abundance mindset. I love that. Not in the abundance mindset, but the scarcity mindset. I can't. Instead of I'm feeding until 9:00 at night, and something takes over, and out come the goldfish.
Yes.
I may or may not have done that once or twice, but I love your framing in the abundance mindset. All day long, we are going to feed this critical ecosystem.
And that also aligns with what you talked about at Women's Health Conversation and some of your other experts. We need to eat, right? We need to nourish our bodies. We need to stop thinking of food as the enemy and as something that we actually need to help us, you know, with our muscle, with our bone, with our brain, with everything. So now, by feeding our microbes more, we're still eating, but if we're looking to reduce a little bit our weight, then we also get this extra bonus advantage of absorbing less calories. One thing people always ask me is like, but I don't want to lose weight. I don't need to lose weight. Am I going to just start losing weight if I eat fiber? I don't think so, because our bodies are smart, right? They know how to channel the energy in the right direction based on what you need. So please don't be scared about that. And just know that having a well-fed gut microbiome is going to help people across different health profiles, across different lifestyle choices. It's something that before we never thought about, and now it is such an integral part of how we think about a calorie. Like when you look on a food label, right, and it says your oatmeal has 100 calories per cup. Well, those 100 calories might be 80 to me and 100 to you. It depends how much of it, you're able to absorb. So it's really something we're also working on, is figuring out how do we incorporate the microbiome side and understanding just a simple calorie and how it might impact people differently. And I think also, how you have those people that can eat whatever they want and they don't gain a pound.
Yeah.
And I look at a cookie and it's like, whoop.
Yep.
They're part of that could be the health of the gut and how they're able to sort of move calories in different directions. Because when the calories don't go into you, part of what happens is that the microbes use it themselves to grow. And we've shown this. And that allows them then to perform better functions. So it's really a winning equation for most people. And I have people say to me, but I have IBS or I have Crohn's and certain foods are a problem. Totally get it. Work with your doctor, work with your dietitian. There are variations that can be made, including doing things gradually to hopefully allow you to get the fiber you need, regardless of what's going on in your gut for most people.
Well, I've loved this conversation. And as we end today, I want to send people off with just a review of the 4 action steps you said based on your research, the 4 things. Write it down, put it in your phone, look at your plate the next time you're eating, and remember the 4 things that Dr. Corbin has taught us. And they are
dietary fiber, resistant starch, foods with bigger pieces, and which are also less processed and don't have those nasty ingredients and those mechanical processing steps that make them just unrecognizable.
So those 4 things.
Yes.
We can all do that. Dr. Karen Corbin, thank you so much for just having this conversation today. It's the microbiome and the gut in general is so fascinating, as is your work. Thank you, Advent Health, for being the presenting sponsor of Women's Health Conversations. Everybody put the save your date on your calendar for November of 26. And just thank you for everything you do.
Thank you so much, Dr. Wright.